Can a uterine rupture cause a baby to suffer a traumatic brain injury at birth? The short answer is that yes, in some instances, a uterine rupture can lead a baby to suffer a traumatic brain injury like HIE. Now, before I get too deep into this video and talk about specifically how this can occur, let's step back and let's define what is a uterine rupture. A uterine rupture is exactly what it says. The uterus, it ruptures. And there are certain types of risk factors which can increase the chance of a uterine rupture occurring. Now, this is not to say that this is something that happens all the time. Uterine ruptures, they actually are quite rare, but in some instances, they can occur. Some of the risk factors for a uterine rupture would be that if you've had a previous surgery in that area down there, and this would include also a previous C-section. If you have if you're having a prolonged labor, then yes, that can also increase the chance of a uterine rupture. If you've been induced, that also can increase the risk of a uterine rupture. In addition to that, if you are having twins or multiple babies, these types of things can increase the chance of a uterine rupture. And if you have any of these risk factors, it's probably a good idea to speak with your medical professionals about the risk of a uterine rupture. Now, like I said, a uterine rupture, it can occur during pregnancy. It can occur anytime during there. It can also occur during labor and delivery. One of the main areas of concern when a uterine rupture occurs is mom bleeding or hemorrhaging. Because if mom is, and especially if you have a severe loss of blood, a uterine rupture creates an obstetrical emergency. It creates an emergency because the risk to mom is great. And in addition to the risk being to mom, there's also a risk to the baby. And like I said, when you have a hemorrhaging situation, when you have mom losing a lot of blood, that can, in some instances, that can have an adverse impact on the baby. An HIE injury, hypoxic ischemic encephalopathy, is, in our context, a reduction of oxygenated blood, which can lead a baby to suffer a traumatic brain injury. And so you can see that if mom is losing blood, because mom and baby are connected, if mom is losing a lot of blood, then it would stand to reason that this can, in some instances, decrease the amount of oxygenated blood that is getting to the baby, which can then lead the baby to suffer a traumatic brain injury. So that is how, in some instances, you can have a baby to suffer an HIE injury when there is a uterine rupture. Now, there's also other things that you have to take into consideration when this occurs. And specifically, when I talked about earlier, a prolonged labor, remember I said that that is also a risk factor. And this is if mom is going through, and I mean, we're talking about a lot of time has passed, especially if you have a prolonged labor and the baby's fetal reserves, let's just say there's problems during this prolonged labor. It's something that is happening that is causing the baby essentially to just causing labor to just keep going. If there are signs or if there are things that are putting doctors and nurses on notice during this prolonged labor, maybe you have a situation where there are prolonged deceleration patterns, maybe there's absent variability, maybe there's bradycardia, maybe there's tachycystole. If these types of things are present, then this also can increase the chance, or this can also lead to a baby suffering a traumatic brain injury like HIE. So if you have a uterine rupture, that is not going to be the end all be all and your baby has suffered a traumatic brain injury like HIE. There are other areas that you have to also take into consideration, because if there were things that were happening earlier in time that put the doctors and nurses on notice that, wait a minute, this labor and delivery is not progressing like it should, maybe we should move and maybe we should convert this over to an emergency C-section. If those things are there and the doctors and the nurses, they're not paying attention or they don't move appropriately to that emergency C-section before the rupture occurs, then there's a strong argument that the doctors and nurses may have violated the standard of care, which is what caused the baby to ultimately suffer that traumatic brain injury. So I know I talked about a lot in this video, and I'm just trying to help you understand that when there is a uterine rupture and when there is a baby suffering a traumatic brain injury and this rupture has occurred, there is a lot of things that must be analyzed to be able to help families understand Was it the uterine rupture that caused the baby to suffer that traumatic brain injury? Or were there other things along the way which also contributed or which are really the cause of this baby suffering this traumatic brain injury? If you have more questions, maybe you're watching this video today because your baby has suffered an HIE injury and you have questions as to was it the uterine rupture that really did it, or were you dealing with a prolonged labor and there were problems along the way which were already suggesting the baby may have already suffered that traumatic brain injury. If you have all of these types of things going on and you would like to speak with me further, what I invite you to do is to get your cell and give me a call. There's a telephone number down below and you can reach out to my office at that number. When you contact my office and you talk to my secretary, make sure that you pick a good date and a time to get on our calendar so we can know when to return your call. In addition to that, make sure that you have a good working email. Sometimes we have to contact you through email, and when we send things out, we want to make sure that we're sending email to a good address, an address that works first and foremost, and an address that you check frequently. One more thing before I get out of here. I practice law here in the state of Maryland, and I know from time to time I have individuals who will contact my office. They are in the United States, but they're not in Maryland. If that is you, then just understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state, and that's something that we can look to work and help you with. But I just want to make sure that you understand that co-counsel or local counsel aspect of things if you are not here in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.